myself in there. Don't worry about it.
Or audience.
Okay. So, all right, imagine this. You're standing in your kitchen and you're cooking dinner, and all of a sudden you slice your hand open. So you stand there for a second in shock, watching it bleed, and realize you need a little bit of help. So you grab a hand towel and you put it on, and you stand and you wait for a few minutes, and you hope that when you lift that towel, you're gonna see that there's no more bleeding and you can just go about your day. Well, you look down after 15 minutes and your towel is completely saturated. You lift it up and there's dark blood oozing that just won't stop. So now you realize I need real help. So what do? You think, I'm probably not gonna call the ambulance for this, but the urgent care is open, but is this bad enough for the ER? So there are certain guidelines that healthcare providers use to tell you whether you should go, I don't need that yet, to the ER or the urgent care or just your regular doctor, or when you should call an ambulance. So if you use those guidelines yourself, you can avoid wasted time and costly medical transfers while getting the exact level of care that you need. And today I'm going to teach you why it matters where you seek care, whether you should go to the ER or the urgent care, or when it's time to actually call an ambulance. Many people are quick to visit the ER for their medical needs when urgent care or ambulance may be a better option. Emergency departments are required by law to treat all patients, whether they can pay, whether they have insurance or not. And we get some patients that, since they won't be turned away, maybe they don't have insurance, they don't want to pay, or they can't pay, that are overusing the ER for all of their medical care, making wait times longer, costs higher, and causes the ER staff to respond slower to emergencies. According to debt.org, it's estimated that more than $18 billion could be saved annually if those patients whose medical problems are considered avoidable or non-urgent were to take advantage of primary or preventative health care and not rely on ERs for their medical needs. There are definitely guidelines for when you should visit the ER and when urgent care will be sufficient for your needs. So when to go to urgent care. Urgent care should be utilized anytime the injury or illness is not severe enough for the emergency room. According to US HealthWorks, 90% of patients who go to the urgent care wait 30 minutes to see a provider, and 84% of those patients are actually out of the office in and out in 1 hour. So patients should be seen in the urgent care for things like minor fractures, x-rays, sprains or strains, back pain, nausea, vomiting, diarrhea, minor headaches, blood work, bump, cuts, and scrapes that require stitches, fever, anything that's non-emergent and non-life-threatening. Ear or sinus pain, vaccinations, cold and flu symptoms, animal bites, foreign objects in the eyes or nose, mild allergies or mild asthma, etc. The ER is better suited for chest pain, difficulty breathing, stroke or stroke symptoms, head trauma, severe bleeding, and loss of vision. The main difference between choosing the ER over the urgent care is the severity of the problem. So if the illness or injury is not life-threatening, you want to go to urgent care or your primary care provider. If you can wait for them to open. If it is life-threatening, you want to go straight to the ER. And if it's immediately life-threatening, you want to call the ambulance. Emergency ambulance services should be utilized when there's an immediate threat to life, or if the patient has a severe injury or illness and can't be transported themselves or by other people. Unfortunately, ambulances are becoming utilized as a taxi service as a way for patients to get into the ER faster without having to wait. And unfortunately for those patients, that actually doesn't work, and it's a really costly plan for them because they still have to be triaged, and sometimes you'll come in on the ambulance, get triaged, and still have to go sit in the waiting room. So it's really just raising healthcare costs for everyone, and it doesn't really do them any good. According to the American College of Emergency Physicians, to help you decide if you should call 911, answer these questions the best you can. Do I have this on there? Is the condition life or limb threatening? Could the condition worsen quickly on the way to the hospital? If you move the victim, will it cause further injury? Does the person need skills or equipment that paramedics and EMTs carry right away? And would distance or traffic cause a delay in the person getting to the hospital? If you answered yes to any of these, that's when you would choose to call 911. The most important thing you could take away from this today is when you should actually call 911. Past that, your insurance provider and your local hospitals can tell you their guidelines on when they would prefer you go to which type of care. And having the knowledge of what healthcare setting to choose can save you stress when making a decision during a crisis, while also saving you money and time. Urgent care, primary care, and preventative care should always be your first choice in healthcare. Those levels of care will prevent future problems, and they will provide you with adequate care and a lower cost in most cases. Emergency departments are for more serious emergencies, and although they will treat you without payment, their overuse raises the healthcare cost for all of us. Remember that calling 911 is always an option. Never be afraid to do so. The dispatcher and ambulance crew can help decide if the illness or injury can be taken care of with or without going to the ER via ambulance. And then I encourage you to find out the guidelines for your insurance and your hospital system before that you have an accident or an injury. And you can even find those online, and you'll be better prepared for an unexpected illness or injury. That's all.
And